Hello, it's Dr. Nadu Tuwakli again, and I want to talk to you today about COVID and kids. So first of all, are you talking to the kids? Are you explaining to them what's going on? Sometimes we assume that kids know what's going on, and yet they really don't, and it just generates more anxiety and panic in them. Kids tend to know a lot more than we give them credit for, and intuitively they can tell when times are rough for their parents. So I want to talk to you about prevention. There are two vitamins I strongly recommend for prevention, improving the immune system. One is vitamin D, and children should take 400 units a day. The other is vitamin C. So for kids who are less than 5, you give them 500 milligrams a day. For kids who are older, they can take 1,000 milligrams, either 500 twice a day or 1,000 once a day. And then all the children should be taking a multivitamin. Now, when I talk about multivitamins, I always tell my moms, I'm not talking about gummies. Gummies have more sugar than vitamins in them. And children get used to the gummies. They like the sweet taste. That's the whole point of it. And so they get either addicted to it or they take it like candy. So give them proper vitamins, increase their vegetables, and model the prevention techniques that we've been talking about for this past month. By this, I mean hand washing, but not just telling a kid to wash their hands. You have to model this for them. So model the washing of the hands, the 20 seconds, the singing the birthday song or whatever, but properly washing their hands, and make them wash their hands every time they come back in the house. Also, make sure they close the toilet lid before they flush. Do some deep breathing exercises with kids and make it fun. Talk to them about social distancing. Explain to them that when people talk, they spray certain droplets into the air, and sometimes those droplets have germs. It's not because people are bad, but we just don't want to get sick. So we have to keep a certain distance from them, even if it's grandma. We must stay active. The children must stay active. It's not possible to isolate a child in a room for 2 weeks if they are COVID positive, clearly. But you can still keep them in the house and make sure if they do go outside, because they should at least go outside once a day for some fresh air, it's not unsupervised. Kids are very gregarious. If you let one kid play outside for 5 minutes, by the time you look around, there's a whole other bunch of kids coming to play with them. And that's not the idea. If a child develops symptoms of COVID, call the doctor as soon as possible. In children, the symptoms tend to be more fever and cough. Lastly, I'd like to talk about mental health in children. Children need to get their sleep, just like adults do. And anxiety is decreased when there is a regular routine. Children don't do well with fly-by programs. And staying in the house now is confusing the children a lot. So you want to try to develop some kind of routine. Also, decrease the screen time, because you have to remember that schools are now doing online teaching. So there's even more screen time that the kids are getting. So you need to limit the screen time. You can kind of use it as a treat or a bait. So if you follow these rules, then you get some screen time with your buddies. So compliance is always an issue with children, but like I said, you have to come up with creative ideas of activities, and you may even have to give them treats just to comply. So watch your children, make sure that they're not showing signs of anxiety or depression or deliberately self-isolating. And if they are, then you should talk to their doctor. So I hope these tips have been helpful, and I look forward to talking to you again soon. Please ask me any questions that you have. I love answering your questions. Until next time, this is Dr. Tuwakli, hoping that you stay well and healthy.